Okay. So how do we approach this? It's a writing task, and Mr. MacDonald, and have you got this task or you haven't?
Doctor, do you know what's its number in the book in 50 tasks?
Uh, well, the name is Mr. Julian MacDonald. You can search that. Let's see.
Okay.
Mm,
Patient name.
yeah, let's see. Mm, Julian. Yeah, Julian MacDonald. 68-year-old male recovering from total left knee joint replacement and needing transfer from your acute care hospital to the rehabilitation hospital. Okay, so we'll take over his care. And the name of the specialist is Mr. B. Mosley, who performed the surgery. Okay, and he's 68. Okay. So let's go down and see what we're going to do. He was admitted 4 days ago for knee surgery at Alfred Hospital, where you work. Using information, write a transfer letter, okay, to the admissions officer at this rehabilitation center, okay? Right? So basically, this is called, we call it a transfer letter, or this is kind of both, it's a handover. It's both discharge and referral to another group. So from hospital to, you're sending from hospital to rehabilitation center. Okay. So any problem?
No.
No. Let's go up
Doctor, I
and,
have a
yes,
question.
yes.
How long does the patient remain in the rehabilitation center? It's depend on the situation.
Yes. There's no
Mm-hmm.
fixed time. Okay.
Okay.
Right. So, Mr. Julian MacDonald, that's the date of birth. And is this relevant? Gold card, veteran efforts?
No.
No,
No.
No.
What does that mean?
Go.
it's the address.
Address.
No.
No,
No.
I
It's
think
insurance.
Yes. It's insurance. But what is a veterans?
Maybe he is veteran.
No.
Sarbo. Sarbo.
No, it's yeah, ex-military.
was
Yeah, ex-military. Okay. So veterans means ex-military. Right. So admission dates for elective left total knee joint replacement and transfer date. So reason for transfer, rehabilitation care. One way, okay. Now, osteoarthritis in the past 10 years. Is it relevant?
Yes.
Yes.
Okay. And gout since
Yes.
2010.
No.
Relevant?
No.
It's some type
Yes,
of
actually.
disease that related to joints and bones
Okay.
and
Now,
can affect them.
yeah, in the rehabilitation center, do you think they need to know he had
No,
gout?
no.
No.
yes, I think yes, because when he rehabilitates the knee, he should prevent to exposure to the joints, especially in the foot, on the foot, for example. Uh, the I
Oh, is
guess
gout is all right. So you mean is gout related
uh,
to food?
trauma is a trigger for go. I think.
Trauma is a trigger. Okay. Well, okay. If you say so. Uh, Now, smoker,
Yes.
yes. Hypertension,
Yes.
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 They
Obesity,
should give him her
Yes.
medication. Yes.
hypocholesterolemia,
No.
Hypo,
I
no.
It's wrong. It's probably hypercholesterolemia. Anyway, okay. PTSD,
No.
PTSD of
yes.
what? Yes, it's important.
alcohol.
Yes.
Yes.
Okay, so he's got a quite a lot of past history. Now,
Doctor, I have
yes,
question.
yes.
Um, I remember that you said us when a patient is obese, there is no need to nothing, no need to say to the referral to patient that say that he or she is obese. And
No, no, no. Yeah, we don't say obese in the letter. This is clinical
no,
notes.
I mean the weight. I mean it's doesn't need to explain her condition when we can see that he is overweight.
Oh, it depends on who you are sending the patient to. If you're if you're sending the patient to a nutritionist, don't you say the patient is overweight?
Yes.
Yes, yes.
Yeah.
We say
So you're sending him for rehabilitation. Wouldn't you say he is overweight? You need to say that, yes, because that affects their rehabilitation. That affects the treatment. Okay, so if it is relevant, we say that. But if a patient has myocardial infarction and you're sending them to the hospital, it is not relevant to say his BMI is 35. That doesn't matter. Okay, it doesn't affect uh, their management. Now, suppose you have, if you work in Tehran, you know that you cannot do MRI scan for the obese patients. So, if I'm sending a patient for MRI, they ask you, okay, what is the weight of the patient? So it is relevant. Yes.
Mhm.
So it
Yes.
depends on the context, not always. Discharge medications. Are the medications important?
No.
Yes.
Yes. Okay.
Yes. They should
Al-
give them to her.
right. Allergies?
Yes.
Yes, but here is actually penicillin allergy,
Can
rash as a child, is actually not a real allergy. And social?
Yes. Leaves alone.
Lives alone in a caravan back of friend's property with 3 dogs, 6 chickens, and a cat. And he has an outdoor shower, uses barbecue to cook, registered with Department of Veterans Affairs, divorcee, 2 strong children, few friends. Is this important? Is divorcee, 2 strong children, few
no.
friends? No, not
No.
really.
Yes.
We can just say he lives alone
Oh,
instead of
yes.
saying all
Yes.
this.
Yes. Leaves alone.
And operative report, medial prepatellar approach, striker triathlon, 3 prosthesis, reinfusion drains in situ, spinal plus GA. Do we need these? Any of these?
No.
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 Um, is the drain still there or is it taken out?
is there.
There.
There
Uh,
is there.
Probably when they send them for rehab, they should remove that. Yeah, they should remove the drains. You don't discharge a patient with drain, do you?
No.
No. Okay. And is it relevant? He had spinal plus GA.
No. No.
No. So what is GA?
General
General
anesthesia.
anesthesia.
So what is spinal plus GA?
Spinal plus
Means
anesthesia. First,
for
spinal,
anesthesia,
then
they use two methods, a spinal block and general anesthesia.
Yeah, probably they have started with the spinal, but he hasn't tolerated, so they have converted to general anesthesia. Okay. So post-operative, significant post-op pain. Is that important?
yes.
Yes.
And he had morphine PCA, and it was inadequate. What is PCA?
Percutaneous.
What
The patient uh,
continuous?
patient-centered administration or patient. um it's the one that the patient chooses to use if they're in pain. So let's see. PCA.
Pain control,
Uh,
autonomous.
uh,
Patient control analgesia.
that's right. Patient-controlled analgesia. That's right. So he had 48 hours of ketamine infusion with effect. Okay, so is that important? Maybe not anymore because he didn't have this. We can just say he had significant post-op. Yeah. So this is not relevant either. Just significant post-op pain and ongoing pain following. Is that important?
Yes.
Yes, of course. And had amitriptyline and difficulty urinating, so ceased. Okay. Is that important?
No.
Yes.
Probably it is because maybe they want to start it again. Okay.
In rehabilitation center, it is they can commence the drug medication.
Yeah, if a doctor visits, they might do that. But
In the is there any GP or doctors in rehabilitation center or
they yeah.
physiotherapist or, for example, nutritionist or so like that?
Doctors visit if necessary. So they might request. So if a patient is in pain, they might request a doctor's visit.
Oh,
Yeah,
yes.
but this is an adverse reaction anyway. This is an adverse effect, so we need to. I think we need to mention it.
Yeah.
Significant somnolence and snoring noted despite inadequate analgesia, so needs formal sleep studies. Is that relevant to rehab?
Yes.
Yes. Yes. Of course.
Uh, I don't know, but okay. CSU grew staph subprophyticus and probably contaminant. The specialist very concerned. So 5 days of Keflex given in addition to 24-hour post-op antibiotics. So is that important?
No.
No. Some mild agitation and insomnia. Is that important?
Mm,
Yes.
that,
Yes.
that,
No
It's and
significant.
that they should be alert about him.
Yeah. So no alcohol withdrawal and nicotine replacement is instituted. Slow to mobilize and okay. Treatment plan. Removal of sutures at day 10. Is that important?
Yes, they should send him to the hospital for sutures.
Yes.
Sutures.
Yeah. A specialist at 6 weeks.
yes.
Appointment made. Okay. Significant rehab, including physiotherapy and
Yes.
occupational therapy, and home visit to assess fitness of returning to caravan. Social services referral, drug and alcohol input, and sleep studies. Obstructive sleep apnea. Is that something to do with the rehab or something to do with the GP?
By the GP.
They
Yeah.
can help doctor.
In rehab, do sleep studies. I don't think so.
No,
I
by giving him oxygen during night.
with CPAP, yeah. Well, I don't know, maybe. Okay, so
So
immediate.
hard, doctor.
It is okay.
It is hard.
Hard. No, okay. Let's
Yes.
see. Now, so you remember the whole thing. Let's go here. So we have a patient called Julian MacDonald, okay, and he is 58, was it, or 68?
68.
He is 68, and okay. Now we want to refer this patient, okay. I'm writing to um, refer this patient or transfer this patient to your care. Yeah. Uh, this patient to your care. Okay. So, is there any more information you would like to give to this rehab officer or admissions officer?
That
Yes.
she's in the post-op surgery of the knee.
Okay, so I take out this patient and put Julian MacDonald and put a 68-year-old gentleman who is recovering from a left-sided uh, total, yeah,
Yes.
total knee joint
Knee replacement.
replacement. Okay.
Doctor,
Yes.
when we have said the age of patient in the reference before the introduction, is it necessary to say again the age of the patient in the introduction?
Um, well, to be honest, it is redundant. Yes, it could be a repetition,
Mm-hmm.
uh, but well, usually we just write date of birth. So as a denominator, for example, we say Mr. Julian MacDonald, date of birth. What was it? Uh, date of birth, 12/1/50. Yeah,
Mm-hmm.
12 1 1950. Okay, so usually we write like this, and therefore, to make it easier for the reader, we say he's 68. Okay, so the reader doesn't need to actually calculate. Okay, but if you have written 68 years old, yes, it is redundant, so we don't want that. But usually, I mean,
Yes.
the routine is this. The routine is how we find which patient this is. We normally use date of birth, and in that
Okay.
case, yeah, we make it easier for the reader. Uh,
Thanks.
okay. So, should we say from a left-sided total knee joint replacement? Okay.
No.
Yeah. What do we need?
Sorry, I think in abbreviation as abbreviation TKJR. I think it is not um, understood by
Right.
rehabilitation center. I think it is better to write the whole
Complete.
complete,
Okay.
yes, complete words.
If you think
Is it
so,
right?
okay. Yeah. If you think so, okay. But I think it is their actually their job, isn't it?
But
Um,
I think they are
yeah.
not surgeon or the physician.
No, they're physiotherapists, and I think, but this is their job. I mean, this is not the first time they're having a total knee replacement patient. In any case, okay. Okay, we are transferring. I'm writing to transfer Mr. Julian MacDonald, a 68-year-old gentleman who's recovering from left-sided total knee joint replacement. Okay, to your care. But what is the purpose we're sending this patient? We have it here, yes?
Plan.
For uh, rehabilitation or for
Physiotherapy, I think the yes, and yes, here.
Okay.
The trans treatment plan, physiotherapy and
Yeah.
occupational.
Could we say for further management?
No.
No. Or for ongoing rehabilitation?
Ongoing rehabilitation.
Yeah.
Maybe.
Or yeah. We can always explain more later. Okay. So it is basically we give the details later. So, but what is the reason? I mean, the purpose of this patient, and we are transferring this patient to a rehab center for rehabilitation. Yes. And
Yes.
what do they do in rehabilitation center? They do rehabilitation. So um, now we can detail later. But if we say we're sending you to rehab center for further management, it's obviously for rehab. Uh, okay. So now, what should I say next? What is the
About the
situation?
surgery, about the first step of this patient, what they
Um,
did in the hospital, the
um,
date of hospitalization, and what they did.
well, the first thing
No.
is actually what the situation is now. We can say, uh, yes, we can say he had uh, he had the surgery. He had a so Mr. McDonald had an elective. Um, TKJR. Uh, could I say it now?
Yes.
Uh, TKJR because we said it above 4 days ago. Okay.
Yes.
Was there any complications or is he okay now? What is the situation?
Yes. He is okay now.
Okay.
He is ongoing pain. I think he has pain.
Right. Good. Okay. So, and although he had an uneventful operation, he required uh, significant analgesia, including uh, um morphine and ketamine infusion. Okay. Uh, what he and he has ongoing pain, doesn't he? He complains of ongoing pain. How do I know he still has pain? How do I know?
Right? In the
In
text.
on the post-operative part,
Okay.
ongoing pain following.
Okay. And discharge medications?
Ibuprofen, paracetamol,
What is oxycodone?
oxycodone,
Oxycodone.
yes.
Okay. So he's got paracetamol, he's got ibuprofen, he's got oxycodone. Okay. So
Yes,
he's
PRN.
yeah. So it is he is in significant pain. Yes.
Yes.
Okay. So he complains of ongoing pain. Now we can mention here what he takes for it, but we can probably it is nicer to say what medications he's taking in another paragraph. But we can say the medicines, the painkillers here. Okay, so it requires significant analgesia, including morphine and ketamine infusion, and it complains of ongoing pain. Okay, right. So this is the situation. He is still painful. What is the other situation which he is not being sent home? What is the other reason?
Because of his situation in caravan. He lives in caravan
Right.
and live alone.
Okay. So do you think that is in the current situation, or do we need to say that in the background?
Maybe it is
I think it's in the
important.
background. Now we say that he needs physiotherapy.
Okay. So there is a lot of background. So what
Mhm.
should we say in background, do you think? And
Past medical history.
right, yes. Before we go there, so he still is in pain, and what is his recovery like? Is he has he recovered well? Uh, Ongoing pain, so he's slightly agitated and
Inside.
slow to mobilize, partly due to pain. Yeah. So he is slightly agitated with insomnia, and he is slow to walk, uh, partly due to pain. Okay. So, yes, now the background. So, what is the most important part of the background?
I think past medical history.
Okay. So, what should we say? What is relevant here? Uh, is it important he had osteoarthritis for 10 years? But no, we know that because he had a surgery and gout. In my opinion, that's not so important. Okay, and this is probably hypercholesterolemia because he takes Lipitor. Uh, right. Okay. So, what should I say, Mr. MacDonald? Tell me.
So it's
Uh,
hypertension.
has a
Has
history.
a history of hypertension, hypercholesterolemia.
Okay, hypertension, hypercholesterolemia. Is it important for the rehab to know all
Not
these?
hyper, not no, not hypercholesterolemia is important.
Hypertension is important.
For
Yes.
giving medication.
Okay. So, how about we say he has a history of PTSD. Hmm? Is that important, you think?
Mm, no, I think it doesn't relate it to
Right. Now,
rehabilitation center.
so I have a suggestion. Let's say Mr. MacDonald drinks, okay, we say about his social history, 6 to 10 standard doses a day, uh, 6 to 10 standard doses per day. Smokes how many cigarettes? 20 cigarettes per day. Uh, per day. Okay. And his BMI is 35, right? Okay. Um, Now, he takes, now we can say the medicines. Uh, Xyluric.
Doctor, in
Yes.
rehabilitation, the patient will be live at least for 1 week, I think, and he will eat their dinner, lunch, and because of that, they should know. I think they should know that he is hypercholesterolemic or has hypertension to give them the proper regime.
Mm-hmm. Yep.
Because of that, I think we should say these things to them.
Okay. 20 milligrams OD. Okay, so if I say he takes Zyloric and Lipitor for hypercholesterolemia, how about that?
Mhm.
I think it is not relevant to
Honest
the
on two birds.
rehabilitation, and it takes long letters.
Yeah. Okay. Let's write and see what it's like. Okay. What is Carvina?
Correct.
No,
No.
it's 300. Uh, Carvina. Cariva. Something, well, we don't know, but it says it is estrogen. It's a contraceptive pill.
Doctor, is Julian
Treats.
female or male?
Yeah,
Yeah.
it's Julian MacDonald. Yeah, it's male. Yeah.
Mm.
Carvina. Well, 300 milligrams. I don't know what it is. Anyway, okay. So if we don't know what it is, then what should we do? We just write the name. Yeah. Uh, Carvina, 300 milligrams once a day. What else? Um, Targen 2010 BD. And paracetamol, ibuprofen, and oxycodone, PRN. Okay. Now we can say paracetamol. What is the dose of paracetamol? 1 gram QID. 1 gram QID. Ibuprofen, 400 milligrams, is it? TDS. And oxycodone, 5 to 10 milligrams Q for hourly. Is that okay? Okay. So let's see. This is 42 words, okay? This is 42 words. Okay. So what else do we have to say? Tell me.
He lives alone.
Okay. Mr. McDonald lives alone in a caravan. Okay. And
About equipment of the caravan. Shower is
with an
out.
outdoor shower. Okay. With an outdoor shower. Okay. Anything else? He cooks.
Barbecue.
Yep. He uses BBQ barbecue barbecue to cook.
Is that relevant?
From safety, yes. Because yeah, that they need to make sure he's safe to go home. Yeah. Okay. And so he uses a barbecue to cook. Okay. and he is a veteran and has a history of PTSD. Is that important?
No.
Why not?
Actually, I think he's going to a rehab center. Is that right?
Yes,
Or,
and then
or
they're
his
going to send him home. Yes.
rehab center sent him to home. Yes.
Yes.
And in rehab center, we have only physiotherapists.
No, physiotherapy, occupational therapy, nurses. So, yeah, he stays there. He has daily physio and rehabilitation. Also, they look after him by giving him the food, encouraging to walk. Um, yeah, and so his home situation needs to be sorted before he goes home, right?
Okay.
Okay, so why do I say it's important? He has a history of PTSD.
She needs medication for PTSD.
Yeah, or maybe just precautions, just to be careful. And you see, he drinks and he smokes a lot. Okay, and do you think he is at risk of drug dependence?
Yes.
Yes, and he had significant postoperative pain, and he had morphine, and he had ketamine infusion, and now he has oxycodone. Do you think these are
Yes.
related?
Yes.
Yeah. Yeah. Okay. So basically, yeah, this is to indirectly you're telling the admissions officer that look, this patient had a lot of pain, had morphine, had ketamine, and now oxycodone, and just you are implying that be careful with the medications, and you need to tighter down the oxycodone. You cannot send this patient home with oxycodone. Okay.
Yes.
Um, okay. So anything else is important here? Uh, so now this is a transfer. So it's both a discharge and a referral. So basically, you need to have a discharge plan. Yeah. So, and we didn't say amitriptyline. Maybe, well, we say later. But so, what could we say? What should we say? This is the plan. Okay. So we say our assessment and plan. What is it? Our assessment and plan. Okay, Mr. McDonald, what does he need?
Follow-up appointment.
Okay, as a follow-up appointment in 10 days time, or we can give them, yep,
6.
in 6 weeks. Okay, in 6 weeks, and we say arranged on 7/9/18. Okay. His sutures need to be removed in 10 days post-op. Okay. So this is day 4. So in 6 days time, basically it means that they need to do that. Okay. We suggest, what do we suggest?
Titration.
Okay.
Analgesic.
It is recommended to titrate his analgesia according to response and arrange for daily physiotherapy to help with mobilization. Okay, what else? His home problem. It is notable that, okay, so he probably needs to check the home situation. So it is notable that his home situation needs to be assessed before by the social services before discharge, okay, to ensure the safety. And what else? Sleep studies, is it related? No. Drug and alcohol input, is it relevant? We can mention it. Okay. I would also appreciate if you make arrangements for drug, for smoking and alcohol. But I think he's been given nicotine patches. Yeah, so we can say that. So yeah, so he's on Nicobate 20 milligram, 21 milligram. So so we say Mr. MacDonald has been given nicotine replacement therapy. But I would appreciate if you could make arrangements for smoking and alcohol counseling. Okay. Right? Anything else? You say instead of making
Doctor, we are
a...
out of words.
Sorry?
243. There is 243 words.
Yeah. So what should we do?
I
We
think we
should
should
omit.
drug. We should include drug, huh?
222 words. Okay. So what is the extra information here, do you think?
Drug,
The
medication.
dosages of drugs.
Okay. So what can we do for that instead of writing the dosages and so much?
The,
We say
the
that
drug
it is
included.
attached to the letter. We have attached the name of drugs to the letter.
That's not very
Usual.
nice. No. So how about I say he takes paracetamol and these, okay. I say he takes paracetamol, ibuprofen and oxycodone for pain, and the rest of the medications are the same. Yeah, could we?
Yeah.
So I can say his Mogadone was stopped. Okay. Mogadone. Well, even we don't need that because we're not writing to the GP. Other medications are used are unchanged. Okay. How about that?
Not bad.
Is it better? Yeah.
Yes.
212. But we don't want, we have nothing to do with this word count. I want you to tell me what information is not necessary here. What is
I think
unnecessary?
shower and barbecue.
Okay. Uh, where is that? Yeah. He lives alone in a caravan with an outdoor shower and uses a barbecue to cook. He's a veteran history of PTSD. So should I take this out?
Yes.
And yeah, the 68-year-old veteran. Is that better?
Yeah.
Okay. So, right. What else? And is it better?
Yes.
Uh, do we need this one line here? Do you think we can put it somewhere else? Yeah, how about that?
Yes.
Okay, so we can say he drinks, okay. He drinks 6 to 10 per day, smokes this, BMI is this, takes paracetamol, ibuprofen, and oxycodone for pain. Other medications are unchanged. Okay. How about that? Yeah, 200 words. Agree? Okay. Basically, it's a matter of judgment. I think what I'm saying is, what do you think? You need to decide based on your clinical judgment. If it is important to say amitriptyline was seized, formal sleep studies, if sleep studies is a responsibility of the rehab center, what I can say is probably when you are sending the patient to a rehab center, you can't tell them to contact social services, but instead you can say, I have contacted them and I have requested an assessment and I have arranged for drug and alcohol input. Okay. So basically, this is not their job. Okay. So, so we can say that and by the social services, and I have made a and I have made a referral. Okay, to that end. Also, he has been given nicotine replacement therapy and smoking and alcohol and counseling has been arranged. Okay, so basically, all they need to do is physiotherapy and mobilization and checking the analgesia and remove the sutures. That's it. In the next 1 week. Now you said that this is 1 week, but yeah, okay. How about that? Do you think it's better now?
Yes.
Yes. Okay. I think even if you say NRT, they wouldn't mind and they would know what it is. Okay. Um, so, yeah, I think this is probably an acceptable letter. But the argument here is because you might say, well, why not we mention sleep studies because it's not relevant to the rehab center, okay? Why we're not talking about amitriptyline? Because they're not going to start any medicines. But if they want to, they probably need to know that. But they probably wouldn't, okay? And is it worth mentioning he hasn't had any significant alcohol withdrawal? It's probably important, but again, he's okay now, so why should I bother? The situation now is that he is okay. He still has pain and he is a bit agitated with insomnia. So this is the present situation, okay? And this is the background and this is the plan, okay? Any problem?
Sorry, in
Yes.
the writing task and transfer plan, we have a immediate situation. For example, immediate treatment or immediate transfer. Is it correct we use the immediate or urgently
Well,
to refer the patient?
no, it's not urgent. It's immediate means without interruption, means without going home and then going there. Immediate has two meanings. One of them means fast. One of them means just without any interruption.
Oh,
Okay?
yes. Yes,
So,
okay.
for example, who's your immediate family member? Who's your immediate neighbor? Okay?
Yes. Yeah.
So that's another. But it's yeah, it is not urgent. Basically, it is um, transfer. Okay.